I am Thomas Yak from South Sudan. I have come to Hyderabad, high-tech city, Yashoda hospital here with my mother at the right-hand side. So we were advised that this revision surgery can be done whether in Egypt or in India. So we opted to choose India due to its advanced technological and professional in the field of medicine. And through the help of some Indian who are friends to us in South Sudan, we were helped to find a good health facility in India. When we came to Yashoda hospital, we were impressed from the people we met all the way before we come to the hospital, the people in person of Mr. Ashok, and the people in person of Mr. Satya Kumar, and the rest that I can mention their name. Mr. Ashok did a very good role to take us to Dr. Mohan Reddy, and Dr. Mohan assessed the condition. With his experience, he smiled and he said that we can do a surgery, although it is going to be a quite complicated surgery because of its complexity, that he said he has to reconstruct something. That is the wall which was lost, and again they put a cuff that can accommodate the head of the bone, artificial bone that he called a femurous head that was actually removed by then. That assessment was done properly because the hospital itself is of a world standard health facility. So the procedures were done and the timetable was scheduled that it has to be the first operation done in the morning because of its complexity. And she was taken to the operation after a time of procedures that were involved. We waited for almost 7 hours. The patient is inside and we become hopeless that she might not even walk out because of the time, the lengthy period of time she has spent inside the operation theater. Fortunately, Dr. Ramwan came out and called for me and told me, Mrs. Thomas, come, your mother is inside. Her operation went successfully, although it was quite complex, but thanks, we have done our best. To my team, we have done our best, and she is now inside. You can go. We rush in with my wife and I find her. She was awake, conscious. We talked to her and we were taken to the room. We spent the period of 4 days in the hospital, and then we were moved to our accommodation, which was in the guest house of the hospital. Then the schedule of reviewing for the period of 4 weeks started. This is the last day now for us. We'll be moving tonight to South Sudan through God's willing. We are very, very happy, and especially on behalf of my team, I am very happy to the people of Yashoda Hospital. May God lengthen their age to do all this thing they do to the people. It's not my mother alone. I have found so many people of my color here. We are living together in the same, and there is no anybody that complain of any failure due to the disease that was diagnosed on him or on her. All of them, they went back happily. I have a test for that. I'm now going back happy with my mother. Thank you, people of Yashoda Hospital. We meet again.
Hello, I'm Dr. Mohan Reddy, orthopedic surgeon at Yashoda High-Tech Hospitals. I mainly deal with the hip and knee replacements, including revisions of failed joints. I would like to talk to you about Mrs. Akol, 61 years of age. She is from South Sudan. She had total hip replacement on the left side in Egypt in 2014. She did well for 3 to 4 years. She developed pain, stiffness, and unable to weight bear one walk comfortably. Mr. Ashok, our business development manager, showed me the X-rays and CT scans. The X-rays showed the cup in the acetabulum had migrated into the pelvis. It was a cemented component. The femoral component appeared well fixed, but there were small signs of loosening. It was a challenging case, and we felt that she would do better in a tertiary hospital referral like Yashoda hospitals. To do this kind of revision hip surgery, we need a multidisciplinary team, including experienced anesthetics and critical care units. We also need a very good surgical team in the theatre who knows how to deal with complex revisions. We also need a good surgical team outside the theatres to coordinate, communicate with the patient as well as to the companies who supply the components. We explained to Mrs. Akol and her family the acetabular revision will need bone grafting, augments and metal shell with modular big head femoral components, what we call MDM, modular dual mobility. We also explained to them that she needs an angiogram before surgery to make sure the vessels and the bladder are not glued to the cup. We need to get all these components from different parts of the country. The surgical procedure took nearly 6 to 7 hours. Post surgery, the patient did well. She mobilized with walker the next day. She was discharged 4 to 5 days after the surgical procedure. She was seen 4 to 5 weeks after the operation. The bone graft which was inserted is integrating properly. She has no pain. The wound has healed well. Today, Mrs. Akol is flying back to Africa, back to her family, fully happy. Thank you.